There are numerous YouTubes discussing the topic of what is the success rate of dental implants, but the reason that you've come to this educational platform is to learn about the critical information that nobody else is sharing with you and that is vital for you to make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I've placed and restored 16,000 implants. In this video, we will discuss important factors such as the overall 95 to 98% success rate of dental implants and how this can be achieved. We will address the misconception about age restrictions for dental implants. We stress the importance of proper patient selection whilst explaining the significance of adequate bone density for successful implant placement. And finally, the potential rare complications and behind the scenes maintenance protocols to ensure long-term implant success. Our goal is to discern the truth from media hype and present you with scientifically backed information. Your time is precious and your health is invaluable, so thank you for investing your time with us. It is sobering to realize and understand that in medical science, and by way of comparative analogy, in the developed world, where there is excellent access to healthcare, only around 85 to 90% of pregnancies typically result in a live birth. However, the success rate of dental implants is generally much higher, and according to published scientific reports, there is consensus that the success rate is 95 to 98% success over a 10-year period. It is vital to understand that the success rates can vary depending on an individual factors such as oral health, overall health, and habits like smoking. And by way of example, one scientific study showed that patients under the age of 40 years had a success rate of 95%, whilst those over the age of 40 had a success rate of about 85%. But it must be understood that it is not the age that is the cause of this discrepancy, but rather the overall health of the patients. It is essential to understand that there is no upper age restriction for dental implants, and by way of example, in my own practice, most of my patients are in their 50s to early 70s, and if you are in your late 70s or even in your 80s or 90s, you are still potentially a candidate for dental implants, but this is based on your oral and overall health. What is paramount is proper patient selection and specific case evaluation to determine the suitability of dental implants for a patient. And in plain language, what this means is careful evaluation as to whether there is adequate bone density and volume in the jawbone of the patient. And this is crucial for successful implant placement and osseointegration. And we have discussed this previously in episode 7 of the patient education series. Osseointegration means that the dental implant is connected and fused with the natural human bone, making them work together as if they were one. Following the dentist's specific post-operative instructions and maintenance, good oral hygiene practices are essential for implant success. And I always make a light-hearted statement to my patients, and I say to them at the outset that the implant is in their mouths, but it is my baby and they need to look after my babies. Regular dental checkups and professional cleanings help monitor the health of the implant and the surrounding tissues. Because dental implants enjoy such a high success rate, consequently complications are rare but can occur, including infection, implant failure, nerve damage, and peri-implantitis, which is inflammation around the implant, and we will discuss this in more detail in episodes 15, 27, and 32 of the patient education series, and how to manage these complications. Early identification and prompt treatment of any issues help mitigate the risk of implant failure. And the comparative analogy that I provide to you is always that if your motor vehicle engine starts making a strange noise, then get to a mechanic before it becomes a big problem. And in my colleagues that I've taught and coached implantology over the years, they know that one of my dictums is that small problems can lead to big problems. Long-term success largely depends on individual oral health maintenance, including brushing, regular dental visits. Please do not floss around your implants. Brushing and interdental brushing are essential for implant longevity, and we have educated you on this central issue in episodes 2 of the patient education series, and I will provide the link to that below. Patients with well-maintained implants can enjoy the benefits of restored oral function, aesthetics, and improved quality of life for many years. Please remember, it is important to consult with a qualified dental implant professional to assess your specific case and receive personalized advice on the expected success rates and potential risks associated with dental implants. If you find our content valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember that the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast, where we'll dive into the topic, can anyone get dental implants, and provide you with valuable insights.